The final method of assessment is tests, and I'm doing this as a separate section just for the sake of time. Now, tests generally fall into one of two categories, objective tests and projective tests. So let's talk about objective tests first. First of all, and this is a big caveat for this lecture and for the notion of objectivity in general, nothing is objective. No test, no report, no conclusion, nothing. And we'll talk more about this issue in a little bit, but I need you to keep in mind the philosophical background that led our field to describe certain tests as objective and others as projective. With the burgeoning of the modernist movement in the social sciences, greater emphasis was placed on that which could be seen. Remember that psychology in particular was faced with the dilemma that much of what we talked about and practiced was unseen. We couldn't pull back someone's skull, or at least not that easily, and look inside, so there was a lot of criticism about the field. In response, the modernist movement started working towards quantifying psychology, translating the unseen into the measurable. The thinking was that if we could measure something and compare that something to a norm sample, it would be more valid or reliable. But as research, theory, and practice have all shown us, just because something is measured and standardized doesn't make it more objective. Biases, cultural norms, etc. still play a role. Theoretically, objective personality assessment is the measurement of certain predetermined characteristics using standardized administration procedures, materials, and interpretive guidelines. And there are objective tests to measure all types of characteristics that are relevant to the assessment and diagnosis of psychopathology. For personality, there are tests like the Neo-PIR, which measures the 16-factor theory of personality, as well as the MMPI-2 and the PAI that capture personality characteristics aligned with different diagnostic categories. There are any number of behavioral questionnaires to gather data about factors such as self-regulation, ADHD symptoms, and even malingering, which is faking symptoms. And then there are a host of tests to measure affect or mood, such as the Beck Depression Inventory, which measures depressive symptoms, or the STAI, or State Trait Anxiety Inventory, which measures both chronic and acute anxious feelings. Objective tests typically involve the use of questionnaires, though some semi-structured interviews or procedures are now in use. And these questionnaires have specific response options, like true or false or rating scales. Responses to the questionnaires are then scored along a number of dimensions or subscales and compared to a norm sample. Now, I would imagine that many of you are familiar with the idea of standardized assessment, but I'm going to go over it anyway, and I apologize for the blurriness of this image. As I said, objective personality assessments all involve the comparison of a client's score to a norm sample. The norm sample is presumed to be normally distributed, following a bell curve, with around 96% of people scoring within 2 standard deviations of the mean. What standard scoring allows us to do is to say with reasonable confidence when an individual's score falls beyond what is considered normal or average in the norm sample. Of course, the idea of normalcy is problematic. We've talked about that before, because to a certain extent, we all have characteristics of all different personality components. What objective personality assessments are intended to do is to ask enough questions about a given personality component so that elevations in scores are a reflection of responses that are significantly different from the norm. How objective personality assessments put this into action is to identify cutoff scores. If someone falls above or at times below a certain cutoff score, then we conclude that they have the characteristics of that domain or subtest, or that the findings are clinically significant. Typically, that cutoff is when someone is 2 standard deviations above or below the mean, but it depends on the test and also what's being measured, where that cutoff actually lies. And this standardization is one of the primary benefits of objective tests. What this standardization means is that objective personality assessments are designed to try and control for internal and external threats to validity. Practically, what this means is that there are specific instructions for how to introduce, administer, and score the test, thus making the test valid enough that we can compare a client's score to the norming sample. If you give an objective test in a non-standardized way, though, then you can't compare to the norming sample. Again, more on that later. The second benefit of objective personality assessment is that because they are standardized, their psychometric properties can be evaluated. so we can know a given test's reliability and validity. In comparison to some other forms of assessment, like projective assessment or behavioral observations, objective personality assessments generally have better psychometric properties. Part of this is because, quite frankly, it's easier to measure the reliability of a questionnaire versus an interview. But the other part is that because of standardization, we're more able to say that a questionnaire indeed reliably and validly measures that which it is intended to measure. Objective personality assessments also have predefined scales or content areas. And what this does is takes a bit, though only a bit, of the interpretation out of the picture. So unlike in projective tests, where you're inferring what a statement or a picture means, in objective personality assessment, the content areas are pre-specified. Finally, many, if not most, objective personality assessments also contain validity scales, which allow you to gather information about how the individual approached the test taking. Whether they were careful or not, whether they responded in a particular way, either saying yes a lot or saying no, and whether they were over-reporting or under-reporting their experiences. Alongside these benefits, however, are also certain problems or drawbacks. First is that although there are known psychometrics for all of the objective measures, those psychometrics aren't always all that great. For example, it's not uncommon for an objective measure to have validity coefficients in the moderate range. In the social sciences, that's acceptable for large samples. However, personality tests are used to assess individuals. And with that in mind, only moderate validity coefficients aren't really all that encouraging and confirming that the test is measuring what it says it's measuring. Related to that, because most test items typically have a certain amount of face validity, clients can monitor their responses, which may be affected by social desirability and perceptions of behavioral consistency. All of this affects the psychometrics of the test. Second, with the exception of some behavior rating scales, objective assessments are predominantly self-report, which doesn't give a whole lot of information about how an individual is experienced by others, just of how he experiences himself. Objective personality assessments also presume trait theories of personality, so that there's something stable within the individual that we're trying to capture, and that's going to come through within the test setting. That's fine if you adhere to a trait theory of personality, but state theories, or the notion that certain personality characteristics will become more evident in certain situations, also have pretty good evidence. And objective personality measures simply can't and don't tap into that. Finally, because objective assessments are by definition standardized, that also means that you as the evaluator can't make any changes to administration that may benefit the clients. So, for example, you can't change how you administer the test for folks with disabilities, for those who speak another language, etc. The other main type of tests that are often used in the assessment of psychopathology are projective tests. And projective tests can be thought of as an approach to gathering information about a person's personality in which the client projects their own internal dispositions onto ambiguous stimuli material. And as Arano states, interpreting information obtained from a testing situation is ordinarily a useful way to obtain access to an individual's psychological makeup. Because when the subject is reacting to ambiguous stimuli, rather than real people and real social situations, he or she is under less pressure from conventionality and is more likely to depict his or her inner feelings. So the way that projective tests typically work is that you provide the client with a stimuli, most often a picture, or it could also be a verbal instruction, and you ask them to react to it either by telling you a story about the picture, describing what they see, or even drawing something. Then their reactions or productions are analyzed in terms of what they might suggest about the client's internal dispositions or functioning. So, for example, I might show a client this picture and ask them, what's the hand doing? We'll talk through a few more examples of these in class so you can get a sense of them. As you could imagine, or you may have heard, projective tests have sparked controversy over the years, primarily because of their drawbacks, which we'll talk about in a moment. But projective tests also have a number of benefits over other forms of assessment. First, because the stimuli is ambiguous, it reduces the influence of social desirability on responses. In other words, because people don't necessarily know what their responses mean or how those responses will be interpreted, because the stimuli is ambiguous, they have a harder time determining what is the desired response. Second, because people are free to respond as they would like to the stimuli, projective tests can also garner a lot more and more diverse information. On the flip side, however, the psychometrics of projective tests aren't that great, so there are some questions about reliability and validity. In addition, the interpretation can be somewhat subjective, and because the stimuli are ambiguous, clients aren't as in control of what they're telling you about themselves as they might be when completing a test with more face validity. So there's been some controversy over whether clients can actually give informed consent for projective tests because they may not totally know what it is that they are revealing. So those are your 3 key methods of assessment that are most often used in diagnosing psychopathology. In the next lecture, we'll talk about how the information garnered from these assessment methods are used to come to a diagnosis.